Ladies and gentlemen, thank you for standing by. Welcome to the NCD Alliance webinar. During the presentation, all participants will be in a listen-only mode. Should you wish to ask a question during the presentation, please use the chat feature located in the lower left-hand corner of your screen. If you need to reach an operator at any time, please press *0. I will now turn the call over to Dain, Executive Director of NCD Alliance.
Thank you very much, and good morning, good afternoon, or good evening, everybody, and welcome to the NCD Alliance webinar. Today we have quite a packed agenda. If we could move across to the next slide, please. In terms of the speakers for today, we have Alena Matzke from the NCD Alliance, Ariella from the NCD Alliance, and Cristina Parsons Perez. And we've also got a guest speaker, Maisha Hutton, the Executive Director of the Healthy Caribbean Coalition. Next slide, please. In terms of the agenda for today, what we're going to be focusing on is an overview of the 68th World Health Assembly, which happened just a few weeks ago in Geneva. We're also going to be giving you a comprehensive update on the post-2015 development campaign. A lot of activity going on currently in New York around post-2015 and financing for development, so Ariella will walk you through that. And then the third agenda for today is an overview and really an update on the Global NCD Alliance Forum that we've got planned for the 13th to the 15th of November. So we'll be talking about the actual forum. Cristina will be talking about the forum as well as the regional preparatory meetings that we're organising in the lead up to the forum in November. So let me hand over firstly to Alena, who will talk about the World Health Assembly outcomes and next steps. Alena.
Hi everyone, very sunny greetings from Geneva. As Katie said, I will be giving you a short update from the 68th World Health Assembly that took place from the 18th to the 26th of May here at the United Nations in Geneva. I'll be focusing on a handful of official agenda items. Item number 13, NCDs, health through the life course, health systems, and the WHO reform. I'll also provide a short overview of the NCD Alliance events that took place during the WHA, and then finish with a brief update on what is happening with the global coordination mechanism on NCDs. Next slide. Before I start, I just want to point you to two links. The first one will link you to all of the official WHA documentation. So if you're looking for any of the WHA reports or resolutions, you can find them by following this link. And then a second one, which is to our website, where you can find daily updates from the WHA, as well as all of the, I think it was 5 NCD Alliance statements that were delivered during the WHA. Next slide. So what stirred the crowds at the WHA? The week started as usual with the Director General's address to the Assembly, as well as Angela Merkel featuring as guest speaker, who focused very much on neglected tropical diseases, the Ebola response, and the antimicrobial resistance global action plan, which would later be adopted by the Assembly. Another, not surprisingly, another hot topic at the WHA was the WHO's engagement with non-state actors. A open-ended working group was working until the very last minute, hoping to finalize the framework for engagement with non-state actors. However, was not able to manage to do so, and I'll provide a bit more detail on this later during the presentation. Another hot topic was a resolution on health and the environment, specifically on air pollution, which was very well received by member states, but yet also accompanied by very clear messages from a variety of member states that increased ambition in this area was much needed. Next slide. So I'll start us off with NCDs and the Second International Conference on Nutrition that took place last November. The discussions around this agenda item very much highlighted the importance of the ICN2 for the overall NCD response and curbing a major NCD risk factor, which is unhealthy diets, emphasizing very much the need to swiftly start the implementation of the framework for action that resulted from the ICN2 and enhance monitoring at the national level of the fulfillment of the framework for action. The countries of the UNASUR voiced the support on the proposed decade for action, which was one of the points coming out, one of the suggestions coming out of the ICN2, and the WHO Secretariat then later on picked up on this point, very much, of course, keen to move ahead with this decade for action, which would ensure sustained action on the whole nutrition spectrum via a very concrete and outcome-focused roadmap to deliver the world's nutrition commitments. The WHA decision, which was adopted, endorsed the ICN2 Rome Declaration and its framework for action, called on member states to implement the framework for action, and requested the Director General to prepare progress reports every 2 years to the WHA in collaboration with the FAO Director General. And I've included a link here at the bottom of the slide if you want to access the decision. Next slide, please. Moving on to maternal, infant, and young child nutrition, the WHO noted a report and adopted a decision, which again you can find through the link on this page. And this decision approved an additional core set of indicators for the global monitoring framework on maternal, infant, and young child nutrition, and took the decision that reporting would take place biannually, starting in 2016, with the exception of process indicators 1, 4, and 6, and policy indicator 1, and reporting on these indicators will start in 2018. And the reason is that member states wanted a bit more detail on these indicators and more operational guidance from the WHO. The decision also recommended a review of the global monitoring framework in 2020. Moving on to the Commission on Ending Childhood Obesity, the WHA again noted a report very much acknowledging childhood obesity as a priority issue for member states and highlighting the importance of multi-sectoral engagement. Brazil also, under this agenda item, called for the WHO to join the Committee on World Food Security in Rome to ensure nutrition is being adequately addressed as a crucial aspect of food security, and also called for an in-depth assessment of childhood obesity at the 69th World Health Assembly. The Commission is actually meeting again next week here in Geneva, and there's a variety of regional consultations taking place in July for the Pacific, and then in October for the Americas region, as well as the European region. And many member states emphasized that they were looking forward to these consultations and considered them as an important priority for them. Also, for those that are following this item a bit more closely, I've included a link at the bottom of the slide that will link you to the submission developed jointly by the NCD Alliance on the interim report that has been published in April and was open for public consultation until the end of May. Next slide, please. All right, moving on to the follow-up to the 2014 high-level review. There was a report that was noted by the WHA, including the 2016-2017 GCM work plan. And the discussions on this agenda item very much highlighted the need for intensified efforts at the national level, and that countries were not on track to achieve the 25 by 25 goal. Repeated calls for technical assistance from member states and a handful of countries also highlighted the need to integrate NCDs into development plans and international cooperation. Many member states expressed their anticipation of a one WHO NCD work plan, urging the WHO to make accessible best practice and facilitate the sharing of experience among countries, for example, on the topic of national commissions. Various member states highlighted the need for fast-tracking of stakeholder engagement through the GCM, and also highlighted that monitoring progress was not a burden but an investment in health. Next slide, please. So looking a bit closer at the timeline ahead of us, in 2016, there will be progress reports that will be submitted to the 69th World Health Assembly on the Global Action Plan and the Global Monitoring Framework based on the country capacity survey that WHO is conducting this summer. There's also going to be country capacity surveys conducted in 2017 and 2019 to inform the respective progress reports on the GAP and the GMF in 2018 and 2020. The WHA report on the follow-up to the 2014 high-level review mentioned the possibility of a second global ministerial conference on NCDs either in 2016 or 2017. There was not a great deal of discussion on this proposal at the WHA, but a handful of member states highlighted that they were in favor of or supportive of such a conference. The GCM work plan, which was included in the WHA report, set a date for the first GCM general meeting, which will take place in 2017, and many member states made clear that they did not want this meeting to take place at the political level, but would rather see this meeting take place at the technical level, given its proximity to the 2018 reviews. They didn't want to take away attention from the high-level political meeting in 2018 and preferred this meeting to be at the technical level. Also good to remember is that an independent evaluation of GAP will take place in 2017 for reporting, for presentation to the World Health Assembly in 2018. The WHO report to the UN General Assembly will be in 2017 in preparation for the UN High-Level Review and Assessment in 2018. And this report in 2017 will be guided by the WHO technical note that was published in May, presenting the 10 progress indicators that were developed for this purpose. I did not mention here the update of Appendix 3 of the Global Action Plan. There's a technical reference group being set up right now, and the review itself will take place in 2016, with the results being presented to the WHA in 2017. Next slide, please. And to briefly leave the WHO for a related update on the ECOSOC. On the 10th of June, the ECOSOC Coordination and Management Segment passed a resolution on the UN Task Force on NCDs. The resolution was tabled by Belarus, the Russian Federation, and Turkmenistan, marked progress of the work by the UN Interagency Task Force on NCDs. The resolution is very short, and it passed without any member states taking the floor. It notes the progress report of the UN task force, which, among other items, provides updates on efforts to strengthen capacities of the UN country teams to support governments in the NCD response through whole of government and whole of society approaches, and in particular presents updates on the missions to Belarus, Kenya, India, and Tonga that took place last year. If you want to read up on the progress report a bit more in detail, there's a link included on the slide. The resolution then encouraged the further scaling up of the delivery of the joint work plan of the UN Interagency Task Force, and to further enhance systematic support to member states at the national level, including by urging the UN country teams to set up resident thematic groups on NCDs to ensure integration of NCDs into national health and development planning, including the UN Development Assistance Framework, or UNDAP. The resolution also importantly requested another progress report in 2016, which means that the task force will be tabled again at the ECOSOC next year. And the resolution, again, can be found through the link at the bottom of the page. Next slide, please. So coming back to the WHA and moving to the agenda item 14, health through the life course, with a very timely discussion of health in the post-2015 development agenda. Member states very much highlighted the need for a holistic approach to health and focus on universal health coverage and social protection. Many member states highlighted NCDs as a priority development issue, particularly for low and middle income countries. And my observation was that specifically RMNCH and NCDs were really highlighted as the most pressing issues by the greatest number of member states of the WHA. The importance of social determinants of health and health-sensitive indicators across all goals was noted by many member states. The need for continued investment in health and need for multi-sectoral action. And a lot of member states also emphasized that the monitoring for the SDGs has to happen in alignment with existing monitoring and evaluation mechanisms, for example, the Global Monitoring Framework for NCDs. Switzerland, backed up by a couple of member states, also emphasized the key role for the WHO and the UN Statistics Committee in the indicator development process, highlighting in particular the need to measure the multidimensional aspects of health, not only within the health goal, but also in relation to other goals. The next agenda item I'm going to cover is adolescent health. Is broad acknowledgement of adolescent health as a key issue. In fact, many member states and NGOs, including the NCD Alliance, took the floor. It was a very broad recognition of adolescence as key to addressing NCD risk factors. In fact, I think it was the UK who said that adolescence was really no longer the healthiest period of life as it used to, and that should be a cause for concern. The report that was noted at the WHA proposes to develop a framework for accelerated action for adolescent health for submission to the 69th World Health Assembly. And the aim of this framework would be to provide countries with a basis for developing a coherent national plan for adolescent health. The discussions got a bit entangled towards the end in differing views on language, on what a safe sexual debut constituted, with several member states asking for amendments that would be sensitive to the religious and cultural particularities of member states. And so this agenda item actually dragged on for quite a bit around these very minute details. Next slide. All right, finishing health throughout the life course with the resolution on health in the environment, specifically air pollution. As a reminder, at the executive board already, member states established a drafting group on this resolution, and informal took place in the lead up to the WHA led by Norway. A WHA drafting group was set up immediately during the WHA, which then produced the final resolution, which calls for member states to implement the WHO air quality guidelines and indoor air quality guidelines to strengthen multi-sectoral cooperation at international, regional, and national levels, focusing very much on knowledge and technology transfers, data and exchange of good practice. The resolution also calls for member states to improve the morbidity and mortality surveillance for all illnesses related to air pollution, for health systems to take the lead in awareness raising with other sectors, and also calls on member states to meet the NCD commitments and their obligations under the WHO Framework Convention on Tobacco Control. The resolution calls on the WHO Director General to significantly increase WHO's capacity on air pollution, to enhance WHO's collaboration with the whole UN system and leverage synergies, for example, around the work on NCDs, and to develop a roadmap for consideration by the 69th World Health Assembly. And the Alliance will follow the development of this roadmap very closely, and we seek to input into this process, and will of course keep you up to date on this very important issue. Very interestingly and perhaps encouragingly, countries such as Switzerland, Germany, Monaco on behalf of the EU and the AFRA region very loudly voiced their disappointment over lack of ambition in the resolution, pointing out that the resolution failed to mention the root causes of air pollution, fails to mention the sectors responsible for the root causes of air pollution, and calling on fellow member states to acknowledge the clear link between climate change and health, and the need to mitigate climate change. And this point was also the focus of one of the WHO technical briefings, which took place during the week on climate and health, in which the WHO Department for the Protection of the Human Environment made a very strong case for the co-benefits of addressing climate change and NCDs. So a lot going on in this area. Moving on to the next slide. I'm going to pass very briefly over this slide. Agenda item 4.4 was on women's health, and member states very much acknowledged this item as of high priority to them, recognizing the challenges and emerging priorities in relation to women's health within the global strategy for women's, children's, and adolescents' health, highlighting the high burden and disproportionate burden of NCDs among women, and underlying the high political commitment on the issue. A resolution on strengthening emergency and essential surgical care and anesthesia was passed at the WHA, recognizing that surgery is central to the spectrum of care, and that the availability of surgical care and anesthesia really does not reflect the need, and that there are significant resource issues here, and emphasizing the importance of partnerships in addressing this urgent gap. Next slide, please. So on the framework for engagement with finance directors, this discussion really dragged on until the very last minute, and until the morning of the last day of the WHA, the Argentinian co-chair of the open-ended working group was still confident that they would manage to finalized the framework, but then they had to acknowledge that that wasn't possible, and that even though good progress was achieved, that further work was needed. Sticking points are still around transparency and accountability, for example, in the classification of the different types of non-state actors, around restricted and unrestricted funding. A lot of member states have a lot of concerns around protecting the independence of WHO, and so that the risks and benefits of engaging with non-state actors have to be more clearly articulated, and then also the disagreement around the point of whether or not singling out particular industries beyond the tobacco and arms industries that WHO should exercise particular caution when engaging with, and there's very much sort of disagreement between such countries as India and Bolivia, who really want to see the food and beverage industry specifically mentioned in the framework, and then others such as the U.S. and EU countries that do not want to see food and beverage being singled out. I've just learned that there will be another open-ended working group meeting, which was called for at the WHA to take place before the end of October this year, and this meeting will take place already in 2 or 3 weeks. I believe it is on July 8th to 10th under the continued chairmanship of Argentina. And the aim is to present the framework to the 69th World Health Assembly. Member states very much emphasized that they were united on this, that they all wanted this framework to be passed, and urged non-state actors to continue their engagement with WHO despite the delay of this work. And the current framework, with all of its different bits of highlights, can be accessed through the link up at the bottom of the slide. Next slide, please. Okay, brief overview of the NCD Alliance events that took place during the week, starting with the joint roundtable on the global strategy on women's, children's, and adolescents' health, hosted by the Partnership for Maternal and Child Health in the NCD Alliance. We're very pleased with a very representative group of participants covering governments, different UN agencies working on maternal, child, and adolescent health, or NCDs, society organizations, and also private sector. Themes covered at this event were the need for better integration of the life course approach in the current draft global strategy, but also the need to improve communication with the decision makers, so clearly articulating the cost benefits of integration to decision makers, backed up by strong data and compelling success stories. Multi-sectoral action and accountability, specifically aligning different accountability mechanisms across maternal and child health and NCDs, was also a topic of discussion. And there's the meeting report that we actually submitted as part of the public consultations on the Zero Draft Global Strategy, and I've included a link on the slide which you can later access. It's a very short report, so it's an easy read. They also hosted a side event on NCDs and the post-2015 agenda, specifically looking at the sort of how of delivering the SDGs, with panels from the World Bank, from WHO EMRO, the NCD Focal Point of Kenya, OECD representative, and then our own executive director, looking at the barriers and solutions in terms of competing interests in developing countries, lack of funding for entities, and the role of bilateral agencies, independent accountability, and also highlighting the insufficiency of UHC alone for NCDs. A very interesting event that Alzheimer's Disease International, the World Heart Federation, and the NCD Alliance hosted on the sidelines of the WHA was entitled "What is Good for the Heart is Good for the Brain," and this very intriguing title probably already says a lot for this event, which looked at the framework for interventions on shared risk factors and comorbidities, particularly looking at the FINGER study, which is the first major study to show efficacy of multi-domain interventions for dementia, highlighting a patient-centered approach and also barriers from the patient perspective. Next slide, please. All right, so my last slide is on the global coordination mechanism. So moving on, having finished the WHA, just want to provide you with a brief update on what's happening with the global coordination mechanism. Just yesterday or today, the working group on financing released its report of its second meeting, which took place on the 6th and 7th of May. And this report summarizes the presentations that were given by several external stakeholders to the working group at the second meeting, but also provides a detailed timeline for the output of the working group. So an interim report is expected in late June, and this report will then be launched at the Third International Conference for Financing for Development in Addis Ababa in July. I believe the event will take place on the 13th of July. This interim report is open for public consultation until mid-August, and all of the input received will feed into a final report, which will be prepared for the third working group meeting in September, is then open again for public consultation until October and will be submitted to the Director General in December. And the fact that the interim report will be launched at the WHO event at Financing for Development is really is a significant for the NCD community, as it will be addressing tobacco taxation, co-financing, and a number of priority messages from an NCD perspective. The working group on private sector engagement is currently meeting. So yesterday and today, the working group held hearings with industry mostly and some civil society organizations, including the NCD Alliance, and probably see a report come out of this meeting in the next month. Also want to briefly mention that WHO has sent out save the dates for the second global dialogue hosted by the GCM, which will focus on strengthening international cooperation on NCDs with North-South and South-South and triangular cooperation. This dialogue will take place late November and will take place from the 30th of November to the 1st of December, and WHO is starting planning around that now, looking at a slightly more interactive and outcome-focused format than the first dialogue, and also looking at how to encourage the broader development community in these discussions more actively beyond the NCD community. So this is it from me. I'm happy to answer any questions if there are any, and thank you for listening.
Excellent. Thank you, Alena, for that really, really comprehensive overview. We've got a few questions that have come in. I'm conscious of time, so we're just going to take the 4 that have come in, and then we'll move on to Ariella. So the first question is from Stefan at World Vision International. When does the Chartered Obesity Commission finish? When does their work end?
That is a very good question. I believe that the final report is planned for November, perhaps December, so this year.
Okay,
so right now,
so
the interim report that was published, and basically all of the feedback that is received from civil society and all relevant stakeholders will feed into the development of the final report, as well as the input from the regional consultations. That I think the last regional consultations happened in October, and I believe, if I remember correctly, it was November, if not early December. That the final report will be submitted to the DG.
Excellent. Thank you. Next question comes from David Patterson at IDLO. Regarding the calls for technical assistance during the NCD agenda item at WHA, the calls for technical assistance to reach the 25 by 25 goals, was there any reference to the need to strengthen legal frameworks?
I don't think I remember that there were. I know that in a side event on nutrition specifically, Brazil called for the strengthening of legal framework, specifically on nutrition, but I do not recall any specific discussions on that during the committee discussion.
Okay, great. Thank you. Ivona Tooth from FCA asks, is there still an NCD meeting in 2015? Because in the GCM work plan, it says that the first global conference of national NCD focal points will be convened towards the end of 2015 by the Secretariat. Is that going on still, do we think?
Ilona, that is a great question. And this meeting has been around for a long time, and it hasn't happened until this point. And to be very honest, I don't know. I haven't heard that this meeting has happened, but it will happen. But I will follow up and get back to you on that.
And I think also just from my side, I think that is happening because they're essentially seeing their meeting of NCD focal points as the equivalent of our global forum in November for national and regional alliances. So I think it is happening. We just need to basically work out what date they're thinking of. Yeah.
Okay.
So Deanna at AHA asks about the Global Coordination Mechanism dialogue that's coming up next in November. What is the specific role that civil society can play there, Alena?
Good question. And so WHO is really quite open to receiving input from civil society into the planning of the dialogue. And right now, they're considering different options for this meeting. And one option would be to have preparatory or pre-meeting, so to say, for the dialogue. So the two days before, 1 day before the actual dialogue will happen in November, they're proposing that the different sectors would meet to develop SWOT analysis that will then feed into the actual dialogue. And it's important to understand that the global coordination mechanism, their mandate does not allow for a more outcome focused does not allow for a very concrete outcome of these dialogues other than the report itself. So the WHO Secretariat really is quite keen to ensure that there's very strong input going into the actual two-day dialogue so that the report includes very strong positions and calls for action. So the idea is that, for example, civil society would convene ahead of the dialogue here in Geneva and conduct a SWOT analysis and enter the dialogue with a very clear position and ask, which I think is quite a good approach. I hope that answers your question.
Great. One final question regarding the GCM from Kimberly Reed. She's asking about the private sector engagement working group and how can we get more details on who was involved and how to keep apprised of the situation. So
certainly, the meeting was public, so it was webcast, so anybody could follow the meeting. I'm not sure if the list of companies that presented is posted on the website. There will definitely be a report that will list who was involved. I'm sure that reaching out to the GCM Secretariat they would also share the list of participants. But I'll check if there's a list online, and we'll get back to you offline.
Great. And I'm sure it will be similar to the previous financing working group, where they've published all the presentations online as well, so they've been made publicly available as well, which is great. Okay, excellent. Thanks very much, Alena. And Stefan, to your question about the financing facility, I'll leave that for Ariella to answer in the next session, because it's related to financing for development. So let's switch over to New York, to Ariella for the update on global development.
Thank you, Katie, and good morning or good afternoon to everybody. Updates on our global advocacy campaigns have always had a lot of information, but this time I really do mean it. So please bear with me as I speed through quite a lot of material to cover today. Next slide, please. So we are going to start with an update on the post-2015 intergovernmentals that took place in May, as well as the session coming up next week. We're going to cover the recent work around developing indicators for the SDGs, including the recent expert meeting that was held in early June. We're going to talk about the upcoming and very hectic preparations for the 3rd International Conference on Financing for Development. That will be in July. And finally, a look ahead to the September summit to adopt the post-2015 agenda. So after 5 sessions on the many elements of the post-2015 agenda, we've now turned it over and examined every corner of the post-2015 agenda. We are now in final crunch time. Next week is actually the start of the first of the final negotiation sessions, so it's a little bit different than the sessions that we've seen previously. It's the first of 3 weeks of these final negotiations. Member states have had 5 sessions now to air their views on all components of the agenda. They now have the 0 draft of the outcome document in their hands, and so it's time to really get down to business and resolve any of these big final outstanding issues. Next slide. Before we talk about the week ahead, though, a quick look back at what happened during the May intergovernmental sessions, which were very inconveniently timed to overlap with the World Health Assembly. The theme for May was follow-up and review, which is perhaps the most impenetrable part of this agenda at the moment, on account of the fact that it relates to questions of UN system governance, considering and unpacking already complicated reporting lines, and no decision yet on what content will actually be followed up on in this implementation phase. But nevertheless, there are a few questions that are now answered following the May session. We know that the follow-up and review framework will do just that, follow-up and review on progress between 2016 to 2030. This includes tracking implementation of the SDGs, collecting and using data to inform policy decisions at multiple levels, and to follow up on commitments by different stakeholders. This is envisaged as being operational by June of 2016 at the latest through a phased approach, and will cover all 3 dimensions of sustainable development, as well as speak to what we've now come to refer to as the 4 Ps, meaning people, planet, prosperity, and partnership. The link at the bottom is to a discussion paper produced ahead of the May session by the co-facilitators that has a far more thorough explanation of the follow-up and review and the different elements in play if you're interested in reading up more. It's also widely agreed that the High-Level Political Forum, or the HLPF, an annual forum that meets under the auspices of the Economic and Social Council every year, is the primary body for the review and follow-up of post-2015. So that came through loud and clear after the May intergovernmental sessions. Next slide, please. Some possible principles outlined for the follow-up and review framework are very much in keeping with the principles already established for the entirety of the post-2015 agenda. They include strong national ownership, but also follow-up and review at the global and regional levels. It would be a universal framework. It would be reporting on a voluntary basis, so not compulsory reporting. It could cover the SDGs as well as the means of implementation, and it could be very much inclusive of all stakeholders, meaning civil society and the private sector and academia. But like every part of the post-2015 agenda, this part too is also rife with political disagreement. On one hand, we have the G77 and most developing countries who would like to see separate follow-up and review mechanisms for the post-2015 agenda, meaning that the goals and targets are separate and financing for development is followed up separately in another track. They view the HLPF, again, as the core mechanism for follow-up, with other bodies reporting into the HLPF. On the other hand is the EU and other like-minded countries who would like to see a single framework that covers both the SDGs as well as financing for development. They would also like to monitoring to be an element of the framework, noting that monitoring and accountability is key to the success of the MDGs. So you'll note I've been saying follow-up and review, but not monitoring and accountability. And the reason why is because you can imagine these are very loaded words and tend to be very divisive words here in New York. So finally, the EU and others view the HLPF as having more of an oversight rather than a core role, sort of a network of reporting that's taking place on the SDGs. Next slide, please. So what's in this for us? A follow-up and review framework will be responsible for reporting progress made at the global, regional, and national levels to achieve the health and the health-related SDGs, which of course include the NCD targets and the NCD-related targets. Our role is to ensure that reporting is coherent and inclusive of existing reporting already underway for health, including the reporting that's done through, for example, the World Health Assembly, reporting on the FCTC, the Convention on the Rights of Persons with Disabilities, reporting done on road safety, a promise renewed for women and children's health, etc. So all of these existing health reporting tracks should feed into the overarching follow-up and review framework in a coherent way. The follow-up and review mechanism is where the inclusion of civil society and other stakeholders really gives us a clear way to show the role of civil society in supporting the implementation of the post-2015 framework, which, of course, we all know is an indispensable part of the work going forward from 2015. And perhaps above all, this is where accountability needs to be and should be at the center of the follow-up. As I've described, this is a really sensitive issue, accountability that is, and there are those who feel that their countries shouldn't be held accountable by anyone outside of their own borders or by the UN system, etc. But I think, we can and we should be able to make a really strong case that it was this data-driven accountability that was the push many countries needed to deliver on the health-related MDGs. And I think that's a lesson that we as civil society should really take on and be pushing into all discussions and follow-up for post-2015. Next slide, please. So in addition to follow-up and review at the May Intergovernmental Session, one of the main items discussed was the proposed revisions to 21 of the SDG targets. The proposed changes were submitted and meant to either fill in X values that were left blank by the open working group or to correct targets that were not up to existing international standards. For health, Target 3.2 on ending preventable deaths of newborns and children under 5 needed some numerical values added in. Target 3.6 on having the deaths from road traffic accidents, and Target 3B, which is a reference to research and development for medicines and TRIPS, which includes access to essential medicines and vaccines, needed clarification according to the language of the Doha Declaration. On one hand, the G77 approached these proposed changes with extreme displeasure, saying they cannot accept any revisions for fear of disrupting, quote, the delicate political balance that the OWG achieved, nor do they want this to be an opportunity for any new issues to be introduced to the goals and targets. Then on the other hand, of course, we have the EU, the US, Canada, and other like-minded countries who welcome these proposed revisions and imply that there's actually probably a little bit more technical work that can be done around the targets to make sure that they are all up to standard. Next slide, please. So by now, you are probably wondering what actually happened in May, and rightfully so. The follow-up and review framework is still undecided and will be left for further discussion during the intergovernmentals next week. Same for the goals and targets. No decision will be taken on how to treat the proposed revisions to the targets, with, again, further discussions to be had next week. Those of you familiar with the game Jenga will appreciate the visual there and understand the metaphor in that we have built ourselves a very delicate and precarious leaning tower of issues that member states will have to get very serious in addressing in this next session as well as in July after Addis. Next slide, please. Moving right along to another very dense area of work is the process to develop indicators for the SDGs. This is very highly technical work, and it's being taken up by the very elegantly named Interagency Expert Group on Sustainable Development Goals, or IAEG-SDG. So what is the IAEG-SDG? It is a body of 28 national statisticians from across all regions of the world. They had their first in-person meeting June 1st and 2nd here at UN headquarters in New York, and the purpose was to determine the process to further develop the indicator framework, including methods of work, and to hopefully do a little bit of discussion on the technical issues. They were also responding to a revised provisional indicator list that was released just ahead of the meeting. This list was very similar to the earlier list of indicators that we saw in March, and only this time it took into account more UN agency feedback as well as national views. You can find all of this documentation through those links at the bottom of the slide right there, and I would encourage you to do so when you have a chance. So the first piece of documentation is the proposed priority indicator list, which is a concise list, a comprehensive list, which is a 93-page document, which is transparent and clear about all of the agency inputs that went into that priority list, and then a draft meeting summary of the IAEG-SDG. Next slide, please. I mentioned that not much has changed in the provisional list that we saw in early March, and that's at least in terms of the NCD targets. So for target 3.4, the associated indicator is still the probability of mortality from CVD, cancer, diabetes, or chronic respiratory diseases between the ages of 30 to 70. That's pulled directly from the NCD Global Monitoring Framework, of course. The indicator on prevalence for tobacco use in adults over 18, which is also included in the Global Monitoring Framework, was moved from beneath target 3.4 to now sitting with target 3.A as a measure of the implementation of the FCTC. Now, this was done to satisfy the request from the Statistics Division of the Secretariat that all targets have only one indicator. Some relevant highlights out of the expert group meeting include interventions on needing data that measure both the outcomes, health outcomes that is, as well as the quality of the inputs and the outputs of the systems. We also want data that that can be disaggregated by age, sex, disability, income, and other relevant stratifiers. WHO intervened to question why the mortality indicator received a Tier 2 ranking when it should in fact be ranked Tier 1 on having high quality and readily available data. They also intervened to suggest that the UHC target, 3.8, needs two indicators, so one on coverage and then a second indicator on financial risk protection, and then also questioned why target 3.9, which has to deal with environmental and other kinds of pollution, has an indicator that only covers outdoor air pollution. Of course, we would like to see indicators that go beyond outdoor pollution and also reference indoor air pollution. However, I mentioned the sort of desire to have one indicator for every one target. It came up from a few agencies and from a few member states that there are targets that just by nature demand more than one indicator, and I think the target 3.8 on UHC is a good example of that. So in this next phase, I imagine we'll be seeing an expanded list of provisional indicators that really does hopefully accommodate the need to have multiple indicators for very complex targets. Next slide. So unfortunately, despite all of this discussion, the first IAEG meeting did not go as well as they had hoped or review as much content that was needed. Still, they will move forward as quickly as possible with the work in order to ensure that the technical pieces of work are kept on track without much delay over process. They're going to be working in two work streams from now on. One will be focused on the conceptual indicator framework and the other focused on the interlinkages across the goals and targets and the more substantive matters of the indicators. We expect to see a tidied up list of that provisional indicator list in the next week or so. And then a new provisional list will be released in August, well in advance of the September summit and in advance of the next in-person expert meeting, which will be October 26th to the 28th in New York. Our priorities between now and then, of course, are to engage national statistical offices and national statistical officers on ensuring that NCD targets retain at least one indicator. Of course, we want to support the indicator on financial risk protection for the UHC target as well as the coverage indicator, and making sure that other health and NCD-related indicators across the SDGs are identified and linked and included in the final framework as such. Of course, a reminder that this work will continue through to March of 2016 when they will agree the final indicator framework. After all of this activity, we move straight into the June Intergovernmental Session, which starts next Monday at UN headquarters. During this session, member states will present views on the recently released Zero Draft that I've now mentioned a few times, as well as give more clarity on how they wish to work in these final negotiation sessions. NCDA will be approaching the session through our usual outreach to member states here in New York, as well as in country on the matters at hand, as well as by engaging with other NGOs in the Health and Post-2015 Civil Society Group, which is currently drafting a statement on the declaration that I anticipate, for those of you on the listserv, will go out in the next day or so, and that we will hope to read out during the Intergovernmental Stakeholder Session next week. Next slide, please. I mentioned the discussions will focus on the Zero Draft. Hopefully a few of you by now have had a time to glance at it already. The Zero Draft has four main components: the declaration, the SDGs and targets, the means of implementation and global partnership, and the follow-up and review. The Zero Draft also has three annexes open for discussion. These include the proposed revised targets, more on the follow-up and review, and food for thought around the technology facilitation mechanism, which I didn't go into and won't go into today, but is another huge area of work for the intergovernmental process. Our analysis of the declaration is actually one of favorability. The draft declaration reads exactly as one might expect it to read in terms of covering all of the issues and concepts that member states have highlighted over the past 3 years, including things and priorities like leaving no one behind, sustainability and climate change, gender equality and women's empowerment, and concepts like inclusive economic growth. We were, I think, really happy to see the prominence given to needing a world that facilitates physical, mental, and social well-being, and I think very surprisingly and wonderfully contains a standalone paragraph on health, which specifically calls out the need to achieve universal health coverage and to, quote, devote greater efforts to tackling NCDs, which we think is, again, really, really a good reference. I don't think we were expecting a very specific reference to NCDs, and we're quite pleased to see that reference in that standalone paragraph on health. Of course, we can't be all positive, so if we are to be somewhat critical, there are some important issues that were left off for the health community that I think some would like to see included going forward in the draft. These include sexual and reproductive health and rights, non-discrimination in the delivery of social services and care, and reaching vulnerable and marginalized populations. Of course, these issues that I just mentioned are red line issues for a lot of member states, so I realize these are quite ambitious asks for the declaration, but nevertheless priorities within the health community. The Zero Draft and all other supporting documentation for this session is available on the Post-2015 website. Next slide. So, leaving the world of post-2015, at least for a moment, we are going to now shift focus on another hugely important process that's ongoing in New York right now, perhaps the most important discussion that's happening right now, and that is the preparation for the Third International Conference on Financing for Development, or FFD3. This conference will be taking place the 13th to the 16th of July in Addis, and it will result in an outcome document, a negotiated intergovernmental text that's currently being finalized right now in New York. For those interested or already planning to participate in Addis, note that the registration is open through the 23rd of June. You can also use the links on the slide to register for the Civil Society Forum that will take place the 2 days prior to the conference in Addis. NCDA will be among those attending the conference. In addition to a preparatory roundtable that we had on NCDs and financing on the 28th of May in New York, we will also be co-hosting a side event in Addis on the 14th of July, focused on sustainable financing for health and NCDs, including best practices for mobilizing domestic revenue, supporting increased bilateral resources for NCDs, public-private partnerships, and other mechanisms to deliver NCDs and financing in post-2015. So if you are planning to attend Addis and would like to be present at our event, or if you're just planning to attend more generally, please do get in touch and let us know. We want to make sure that we are covering health appropriately and making sure that we have a good spread of civil society representation there. Next slide, please. The biggest piece of the FFD conference is going to be the adoption of the outcome document, as I mentioned. Negotiations have been ongoing for several months, but this week is the final week. However, you'll see I put quotations around final because although the co-facilitators are quite insistent that this is final and that they conclude by Friday morning, so I guess that's tomorrow morning, we all know how intergovernmental negotiations can often exceed timelines. So we will see if it's truly the last week, but the co-facilitators are really, really firm on wanting to be done before the intergovernmentals and certainly before we get to ADIS. This is especially true for FFD and wanting to be done, and part of the reason why is because we are dealing with some enormously large ideological and historical divides on financing for development. Specifically, how far forward we can move from Monterey and Doha towards a new financing agreement. There's sensitivity on how to balance financing sources, with developed countries pushing for an increased emphasis on domestic resources and public-private partnerships, but with the G77 and many developing countries really wanting to see priority given to the leading role of development assistance with other methods for financing supporting ODA. It remains to be seen how ambitious any of the commitments in this outcome document will be, or how they will resolve the issue of financing as separate from or part of the post-2015 agenda. But whatever comes out of this will be fed right back into the very final post-2015 negotiations at the end of July, which will be 2 very difficult weeks. Next slide, please. And I should just sort of back up and say that was, of course, a very top-line overview of the major contentious issues for FFD3. There's a lot more that can be said on all of this, but it is quite a lot to cover today. So if you are interested, get in touch with us. We'll be happy to talk with you more about this and hear more from you on sort of your experiences. But for the purpose of time, really can't go further into detail for this right now. But what I can tell you are our priorities for ADIS in the outcome document, and they are, of course, ensuring strong references to NCDs in health system strengthening and universal health coverage in terms of ensuring delivery of adequate and efficient basic services are delivered and efficient domestic spending and delivery at the national level, as well as the role of research and development for NCDs, medicines and vaccines. We've also been working with partners at FCA, the World Lung Foundation, and others to do strong outreach around ensuring a reference to the Framework Convention tobacco control in the ADIS outcome document, but equally important, a reference to tobacco taxation as a tool for sustainable development that both generates revenue for countries, but also leads to improved health outcomes. So a win-win situation that we want to see enshrined and inscribed in the ADIS outcome document. So far, there's been support for the FCTC reference, with some caveats, of course, and some lukewarm reception and some flexibility from member states to see a reference to taxation under domestic resources. Important actors like the World Bank have also issued their support for a reference for taxation in the room, so member states could hear them say that tobacco taxation is something that we would like to see in the outcome document. But, of course, there remains to be a lot of support that needs to come from member states and from in-country to ensure that this reference is included in the final text. So I would encourage any and all of you on this webinar right now who are willing to do some outreach to countries on this and to be in touch with me as soon as possible so that we can get as much support around taxation within FFD mobilized in these next few days and, of course, going through to ADIS, no matter what the outcome of the outcome document is. So tobacco taxation and the reference to tobacco taxation and really needing to do a final push around that in these coming days. Next slide, please. So finally, moving away from ADIS, I'm going to talk about the very serious endpoint to all of these very tense negotiations and processes, and an endpoint that I'm sure all of you are very much looking forward to, and that is the summit to agree the post-2015 development agenda. This summit will take place in New York on September 25th to the 27th, which is a weekend. It's going to be at the heads of state and government level, and there will be participation from the heads of the UN system as well, civil society, and academia. Registration for this summit is not yet open. Information has not yet been released, and we will certainly inform you when it is. The centerpiece of the summit will be 6 interactive dialogues, all under the overarching theme of transforming the world, realizing the post-2015 development agenda, Roundtable 2 will also cover health underneath the focus of tackling inequalities, empowering women and girls, and leaving no one behind. Next slide. To better inform the September summit, the president, go one slide back, please. There we go. So, to better inform the September summit, the President of the General Assembly held an interactive hearing with civil society on May 26th and 27th. This gave civil society an opportunity to really air their views about all matters related to post-2015. NCDA was fortunate enough to be chosen as a speaker on the SDGs, and we were very fortunate, even more so, to have Sandy Mullen from the World Lung Foundation speak on behalf of NCDA, and Sandy gave a very compelling story of a young woman in India who lost her life from cancer caused by tobacco use, with a call that we all sort of remember that the SDGs are not only words, but there are real people and real stories behind the SDGs, like Sunita's story, and that member states and civil society are all accountable to delivering on the SDGs in order to make sure that we can end these preventable deaths. It's a really powerful statement. It's available via the link on the slide right there, and if you have a moment, definitely read it, because it was a great and compelling call to action. Next slide, please. So, adding to the CSO hearing participation, we are, of course, also starting to map out our engagement around the summit itself. We will have our usual civil society pre-meeting on the Thursday before the summit. So that's Thursday, September 24th. Then on Saturday at the lunchtime, we will be holding a side event near the UN. The summit ends on Sunday evening, and the high-level debate, which is when all the heads of state make their grand political declarations, will begin on Monday morning. But of course, the summit ends on the Sunday with the adoption of the post-2015 agenda. So hopefully we'll all be around and able to take a step back and really celebrate this monumental achievement, both, for health and NCDs, but for the entire community that's been engaged in developing this framework over the past couple of years. And finally, I should also note that in addition to the summit and the debate, this year will also be the 70th birthday of the United Nations. So happy 70th birthday to the UN in September. Next slide, please. So finally, what can be done? I've mentioned some call to actions along the way, but just to recap, supporting our ongoing advocacy in these final phases of FFD and post-2015, as well as tracking these final stages, are of utmost importance. There is an open call right now issued by the UN Non-Governmental Liaison Service on comments for the post-2015 declaration. We'd encourage you to submit any comments you may have, hopefully building off of ours if you agree, to UNNGLS, and that should be done by June 21st. We, of course, have our post-2015 toolkit and resources available for you on our website. And finally, we'd love to hear from you on FFG and post-2015 and what your priorities are going forward, and of course, past September, because we cannot think that the work ends with the summit in September. Of course it doesn't. It's only just the beginning. So with that, I will thank you for your attention, of course, today, but as always, over the course of this campaign, it's been a lot. And I think as we come to this final phase, it's really sort of impressing to me and to all of our community just how much work we've all done together on post-2015. So my sincere thanks for everything over the last couple of months and years.
Excellent. Thank you very much, Ariella. That was a really, really impressive overview of a great deal of work going on in New York at the moment. So we've got a couple of questions coming in particularly around FFD. Stefan from World Vision International earlier asked, has the NCD Alliance had discussions with the Global Financing Facility for Women and Children's Health about NCD financing issues? Because obviously the GFF will be launched at Addis in July.
Yes, I'm sorry I forgot to answer that question, Stefan. It's a great question. So as you mentioned, for those not aware, the Global Financing Facility, which is hosted by the World Bank but being launched with support of the Norwegian government, the U.S., Canada, and others, will be launched at Addis. This is a great opportunity for us to really be promoting the integration between NCDs and the RMNCAH agenda, so reproductive, maternal, and newborn child adolescent health agenda. We had submitted a statement and some response to the Global Financing Facility as they designed the framework for the GFF. We are also following it from a perspective of the investment cases that countries will be making. So we know that at the launch in Addis, 4 countries will be presenting their initial investment cases for the GFF. And included in this can be commitments as well as plans that very much relate to the NCD and health agenda. And I'm thinking in particular of, for example, commitments and investment cases for things like strengthening civil registration and vital statistic systems. We know that we get a lot of NCD mortality data and morbidity data from CRVS, and that strengthening CRVS is a key priority for the NCD community, and it ties directly to the ambitions and the outcomes from the GFF. So there are a couple of pathways into the GFF, but both in terms of programmatic interest, but also systemic deliverables from the GFF, and so we're following from those angles.
Great, thanks, Ariella. Another question around Addis from Anjuli. Is there support for civil society participation at Addis from the UN or others?
That's a great question. I think the UN would probably have the best information on that. I'll also have a look. I'm not sure generally for participation. They have a small bit allocated for civil society participants who are actually presenting. But again, I can't say with certainty, so I wouldn't purport to know exactly how much is available or if it's available at all. But we can certainly follow up on that.
Great, thanks. One final question, because we've got to move on in a minute to the forum, from Aaron. With the NCD Alliance advocacy around targets 3.4 and 3A, the FUTC implementation target, is there an interest by NCDA in ensuring that these targets also include children and youth?
That's a good question. So we will recall that the indicators that we have been supporting in the provisional framework are themselves kind of aggregate indicators pulled from the global monitoring framework. Of course, if we had our way, we'd be able to see every indicator relevant to all age groups from the global monitoring framework slotted underneath 3.4 and 3A. But unfortunately, because of the sort of demands upon this global indicator framework, that they would like to see only 1, maybe 2 indicators per target, we've been supporting the sort of overarching aggregate indicators that the WHO has themselves supported, as well as looking at ways in which we might be able to see indicators for NCDs included under the maternal and child health targets. So I guess it's a long way of saying that we are supportive of the indicators proposed, but open to the possibility of other indicators that can speak directly to the different age groups as we know they need to.
Great. Thank you very much, Ariella. And we now have to move on, unfortunately, to the next agenda item because we haven't got too much time left. But thank you very much, Ariella, for all that impressive information. I should have reminded everybody at the beginning that the PowerPoint slides and the recording of the webinar will be available on our website. So if you want to kind of listen again to any segment or obviously download the slides, they will be available after the call. Okay, so moving on to the final agenda item is an update from Cristina, who is our project director for our in-country work and the forum itself. This is obviously our first ever Global NCD Alliance Forum, so we're very excited about it. So over to you, Cristina, for an overview of what's going on.
Thank you, Katie. Good morning and good afternoon, everyone. It's a pleasure to be here today with you in this NCD Alliance webinar. Like Katie says, we are extremely excited at the NCD Alliance of sharing this news with you. The first ever Global NCD Alliance Forum will be taking place later this year in November, and this is really the result of a pipe dream of the NCD Alliance, with really responding to what the NCD Alliance is seeing happening in the field, which is a growing momentum of national and regional NCD alliances being established, and the concept of the forum is really bringing together this community that is being established now, so that we can really go forth with our respective advocacy issues. So it will be taking place the 13th and 15th of November, and this, of course, is hot on the heels of what will be happening in the UN in New York in September, and this is a great opportunity to reflect in this new world order. The The forum will take place in Sharjah, which is one of the United Arab Emirates, and the forum's ambassador is Her Highness Sheikha Jawahar bint Mohammed Al Qasimi, wife of the ruler of Sharjah. And Her Highness is the founder and the royal patron of Friends of Cancer Patients, who are the local host organization together with the NCD Alliance. The forum is organized under an overarching theme, and that is NCD advocacy and accountability in the post-2015 era. So this is great timing for the community overall to come together and really take stock in what has been achieved so far and how we can learn from each other, and also what needs to be done next. Next slide, please. So the forum is aiming to convene approximately 200 participants. The forum will be attended by invitation only, and we are aiming to have approximately 100 key global health stakeholders from different sectors and representing different organizations with presence in different countries. We're really looking at bringing together a community of thought leaders and connectors. We really want to make sure that we are encouraging building new working relationships and networking. It's key to say here that the forum is truly targeted at national and regional NCD Alliance representatives. So we are aiming to have over 80 representatives, and our latest count was that the NCD Alliance is aware of and in contact and knowledgeable of 36 national NCD Alliances and 4 regional NCD Alliances. So we are looking at having at convening this community from really of global representation. The purpose of the forum is to really to provide a safe space for exchange of best practices and experiences, and to build a community. We're really looking to encourage twinning and just those collaborations between NCD Alliances themselves, as well as kind of encouraging relationship building with broader and other stakeholders. The forum is also aiming to build the capacity of this broad civil society network, and ultimately the forum will also serve the purpose of providing a space for us all to build our joint advocacy agenda, be it at the global level, but also at national and regional level. The format of the forum will be that we will have 2 days of plenary sessions. We will have interactive workshops, and several of them will be happening simultaneously because we know that there is a lot to cover in this first ever convening of the community, and there will be several sessions that will stimulate networking as well. It is essential to note here that I think that we are extremely privileged, and this is with thanks to Her Highness and our colleagues in Sharjah, that we are in the unique position of having funding for national and regional NCD Alliance representatives. And we are specifically looking at sending in the next couple of days national and regional NCD Alliances that the NCD Alliance itself has been in contact and is aware of, will be receiving an email from the NCD Alliance with a description of the forum and a request for nominating their representatives. And there is funding for approximately 80 representatives in total, and we're looking at inviting 3 representatives per each regional alliance and 2 per each national alliance. We will be sending them an email then outlining the process with a list of the named alliances that are invited to nominate representatives. We will be collecting those names and the contact details of those representatives, who will then receive an official invitation and details for travel grants. Next slide, please. I should mention that in in the next, that invitations overall for so beyond speaking now about, the global health stakeholders, and so thinking beyond the Alliance, the regional and national Alliance representatives, we will be issuing those invitations in the month of June. So please look out for that. The forum is also going to be conducted in English, but there will be a simultaneous translation in Spanish for the opening and closing ceremonies as well as the plenaries. The forum will be focusing on three key areas: advocacy and accountability, so really translating this bulk of global action that we've seen and global commitments into national and regional action on NCDs. It will focus on on capacity building, so on organizational development, and also on that concept of stimulating collaborations and partnerships, and how we can encourage twinning between NCD alliances to increase impact of work. Next slide, please. Two key things are happening in preparation for the forum. One is a situational analysis of national and regional alliances, and the other are regional preparatory meetings that are happening in the lead-up to the forum. Next slide, please. The situational analysis of alliances. This is quite impressive piece of work that is happening at the moment, and as the NCD Alliance is convening the Global NCD Alliance Forum this year for the first time, we are of course acutely aware that we really need to understand the community. And so in order to do so, the NCD Alliance has commissioned two independent consultants to conduct a comprehensive situational analysis of the different 36 national and 4 regional alliances. We are looking to understand what do these alliances look like, what are their governance structures, how they were founded, how they came to exist, what are their areas of focus, their specific advocacy agendas, what have been some of their successes to date, but also what are some of the challenges that are facing, and what are some of their specific capacity building needs. And we're looking to identify trends across agendas and structures of the alliances and regions, and the findings of this analysis are really going to inform the content of the forum, as well as the NCD Alliance's work supporting national advocacy, and that key part of the NCD Alliance's strategic plan going forward. The situation analysis will include an online survey, which will be coming your way very, very soon. In fact, this will be coming your way next week. So we please encourage you to complete this. We are very, very interested in hearing from you about your alliance. The NCDA will also be conducting in-depth interviews. We are aiming to conduct to interview one key contact per each of these 36 national and 4 regional NCD alliances to really delve into the survey responses and to truly attempt to understand and tease out the information and the data emerging from the different alliances. And finally, the third inputting strand into the situation analysis is information being collected at regional preparatory meetings, of which I will tell you now about. Please, next slide. So regional preparatory meetings are ongoing. We've had a couple happen, and more still to come. But these are meetings that are really leading up to the forum, in the knowledge that there is a bulk of common experiences to be shared at the regional level. So these have been convened. They really want to start bringing together the NCD civil society communities, as well as other stakeholders, key NCD stakeholders in the region, to foster collaborations, to nurture budding national NCD alliances, to help define regional NCD advocacy agendas, and to also identify capacity building needs of the region, civil society, to inform the Global NCD Alliance Forum, as well as other civil society strengthening initiatives that might take place in the next few years. This is very, very valuable information and networking happening at the regional level. Next, please. Now, these are led, the NCD Alliance is is involved in the different preparatory meetings, but they're really being led by either regional NCD alliances, or in several cases they are being led by the regional WHO office. So this for us is a really interesting model, because we're also looking to see if we can strengthen some of these connections between civil society and WHO offices, and really try to bring an interesting mix of NCD stakeholders. You can see that we've already had two happen, one in the Caribbean and one in Latin America this month of June, and we have several still to come. The next one will be in New Delhi in the beginning of July. We are very fortunate to have today on this call Maisha Hutton, the Executive Director of the Healthy Caribbean Coalition, who is a national implementing partner of the NCD Alliance. Maisha, would you be able to give a brief update, please, on the Caribbean Regional Preparatory Meeting, please?
Hi, Cristina. I dropped off earlier, so just confirming that you can hear me.
Yes.
Great. Good. Okay, thanks. Thanks for having me share a bit about our meeting. We had our meeting on June the 6th, and it was the last of a series of 3 NCD meetings. The first 2 were held in partnership with the Commonwealth Secretariat, focusing on engaging the private sector, and the second one was on strengthening the Caribbean's multi-sectoral response to NCDs through instruments known as National NCD Commissions. The civil society meeting was attended by 14 civil society members of the HCC who incidentally participated in the prior meeting. We had representation from primarily health NGOs and 1 non-health NGO. In attendance was Sir Trevor Haskell, who's the president of the HCC, our patrons, Sir George Alena, and Dr. Carrie Adams, the chair of the NCD Alliance. The meeting focused on identifying regional priority areas, as Cristina discussed. Those focused on NCD advocacy against the background of the recently completed civil society-led NCD regional status report, which was done through the NCD Alliance funded project. Out of that report emerged a call to action to guide evidence-based national and regional civil society-led advocacy in the region. And the advocacy priorities were also examined within the context of the post-2015 development agenda. We also discussed mechanisms for building the capacity for advocacy amongst membership in the region to be effective advocates amidst competing priorities such as service delivery and fundraising for income generation. So advocacy is a new concept, and we've got to work hard at building that capacity in the region. So our key priority areas emerging from the meeting at both the national and regional levels can fall into 2 broad categories: capacity building and strengthening of our networks, and advocacy priority areas. So under the first category, we have strengthening the capacity of our NGOs with a focus on, and this is advocacy capacity, with a focus on post-2015 agenda and the SDGs, and how will these translate at a national level, and what's the role of the civil society organization there. Strengthening the capacity of NGOs to contribute to national surveillance systems, using data that they currently collect that's neither collated or analyzed, training and health leadership, strengthening the capacity and frameworks for greater multi-sectoral action for civil society, the public sector, inclusive of the whole of government and private sector. Further strengthening of the HCC, Healthy Caribbean Coalition network, to facilitate greater sharing and cross-fertilization, and exploring the development of national NCD alliances in the region. Currently, there are no national NCD alliances. There is only the 1 HCC regional alliance. And the key advocacy priority areas were expanded access to palliative care, establishment of cancer registries, expansion of insurance coverage, health system strengthening with a focus on strengthening the primary health care system, including updating and use of standardized guidelines, especially as it relates to hypertension, full implementation of the FCTC, population salt reduction through various mechanisms, including reformulation of products manufactured in the Caribbean, and addressing childhood obesity through the targeting of ministries of health and education to develop and implement and enforce policies aimed at creating healthier food environments and increased physical activity in schools. So we have a much broader membership. We have approximately 55 health NGOs and 65 plus non-health NGOs. And the plan is to expand this assessment to those virtually so that we will be capturing perspectives on NCD advocacy priorities and capacity needs from our wider membership to inform the global forum in November. And that's it. Thank you.
Thank you, Maisha. I think it's going to be really interesting for us to see, to really kind of compare and contrast the different regional advocacy agendas that are emerging from the different regional preparatory meetings. Unfortunately, we won't be able to have today the executive director of the Inter-American Heart Foundation, who hosted the regional preparatory meeting in Panama, but we do have Dain, who did participate and take active part of that meeting. So perhaps you can give us a very brief update as well, please.
Sure. So in terms of the Healthy Latin America Coalition meeting, which was organised just off at the same time very much as the Healthy Caribbean Coalition on the 8th to the 10th of June in Panama. This one was organised very much led by the Healthy Latin America Coalition in collaboration with PAHO, the Ministry of Health of Panama, and the NCD Alliance as well. So I was very pleased to be able to attend this one, and Kerry obviously attended the Caribbean one from NCD Alliance. So the Panama meeting included around 50 civil society organisations from a real range of backgrounds. Interestingly, within the Latin America region, we have 8 national NCD alliances as well as the regional alliance. So representatives from those alliances were there as well. And we had representation from 12 Latin America countries, which was fantastic. The main aims of the meeting for this one was to very much kind of share and discuss experiences, lessons learned and challenges specifically focused on prevention. So the meeting didn't begin to address health systems or treatment or care. It was purely focused on prevention policies. Secondly, the meeting was aiming to agree regional priorities and positions, and I'll talk a little bit about them in a second. And thirdly, to really strengthen the role of the Healthy Latin America Coalition class, and to really strengthen and promote and really cultivate more national NCD alliances, because we can see in Latin America that the impact that alliances at the national level, such as in Uruguay and Brazil, are having at the national level for NCD policy. In terms of the kind of regional priorities and positions, the meeting particularly focused on 3 issues, which were the proposal which has been discussed at length over the last couple of years for a global framework convention on healthy diets. Secondly, there was a lot of discussion on the role of the food and beverage industry. And then thirdly, the meeting really focused on the post-2015 development agenda. And as a follow-up, essentially what the meeting participants will do is finalise position statements on those 3 critical issues, which will then be used very much by the Regional Alliance class, as well as obviously its member constituencies for future advocacy. In terms of the kind of main outcomes of the meeting, as well as those position statements I just mentioned, there is a press release from the meeting, which you can link at the bottom there to read the press release. And also one of the main outcomes will be a really concrete kind of an advocacy action plan for the regional alliance. Because to date, class has been somewhat ad hoc in its work and in its priorities. And so this meeting really resulted in some very strategic priorities for advocacy going forward, which is obviously fantastic from our perspective. So that's a very quick overview of the Healthy Latin America Coalition meeting.
Thank you very much, Katie. Could we have the next slide, please? Okay, so here, just to give you a flavour of the different meetings. I think, the next slide, please. So I think what is important to recap is that this is the first time that the NCD Alliance will be convening this fantastically diverse and active community of advocates and global health stakeholders. So we are very much looking forward to the forum in Sharjah over the next few weeks. You should expect the NCD Alliance will be issuing out invitations. National and regional alliances will be receiving emails outlining the process for them, and we will also have web pages on the Global Forum live as part of the NCD Alliance website. So thank you very much.
Excellent. Thank you very much, Cristina, and thank you to Maisha as well for sharing insights from the Caribbean meeting. So I don't think we've got any questions at this point for Cristina or Maisha on the Global Forum. Cristina, just one question from me before we wrap up. In terms of the kind of main outcome from the forum, what do you see as the kind of main outcome from the forum in November?
I think we are looking to increased collaborations between the alliances, and I think we're also looking at increased capacity of the civil society network. We've heard today about the very significant body of work that is happening at the global level. So for us, a key outcome of the forum is for participants to leave with a clear idea of what they can do at a regional and national level to make decision makers to hold them accountable to the global commitments that we are seeing.
Great, thank you. And we just had a question in from Luis, who's from the Mexican NCD coalition. How do we know more about the forum? And obviously, Cristina, you just mentioned that invitations will be going out shortly.
Yes, and for the national and regional alliance representatives, the first email regarding the forum will go out in the next by the end of tomorrow, Friday.
Great. Okay, well, thank you very much, Cristina and Maisha, again for the presentation on the forum. And thank you to all of our speakers today, Alena and Ariella, as well, for the really comprehensive updates on the global campaigns. Just as a reminder, the slides will be available on the website, as will a recording of the webinar be available in case you want to listen again to any segment. And our next webinar will be in a roughly 6 weeks' time. As soon as we've sorted out a date, we'll obviously let you know. Thank you very much for joining today's webinar.